palpation and flexion, and then do an S to I glide. And then we're going to do a different move, put the arm in abduction and do an S to I glide. This, as you learn in your lecture class, this inferior glide, this S to I glide, is one of the most commonly lost motions, especially with this adhesive capsulitis, which I keep going on about because it's something that you're going to be treating a lot of with manipulations and mobilizations.
Isn't that also the most common rotator cuff, shoulder dislocation direction? Inferior?
Inferior and also anterior for motor dislocation. Put your hand behind your neck. Okay, so we're going to start off with this hand behind the neck position to get him into flexion, and then I'm going to have him release that, and we're going to put him in a better position. This is how we start. Okay, I'm going to kneel outside of the table. This is my contact. It's interdigitated or hand over hand. So this depends on what you want to do. It doesn't matter. Okay, now let your arm relax. So here's my interdigitated, and I'm tight to his joint. Notice how I took his arm down to 70. That's my start position. I'm taking my AC joint and sticking it right at the distal end of his elbow. I'm going to lean into it in a second, but first thing I'm going to do is traction him laterally. Now as I lean into it, I'm going to distract inferiorly. So there's my joint slack, there's my spring. So again, it's going to be lateral to open the joint, counter force with my shoulder and my hands, spring. S to I inflection. I didn't overflex. Right? I dropped him back to 70 to start. I only took him to 90 to finish, and then spring. Let's do over here, and then I'll repeat over here. Okay, so this is done from the head of the table, hot and side actually, head of the table, side of the table. You have your arm. I'm going to put it right down by my knee. I'm going to lean on this because I'm going to traction his arm this way this time. This is my thumb way of contact on his humeral head, again, tight to the joint. And here's how I do this. I'm going to distract, little counter force, spring. So I went LID that way this time. Here's my counter force action by pulling this way and then pushing inferiorly, and then spring. S to I in abduction. Over here, him behind the neck to start. So, okay, let your arm relax, pick it out. There's my shoulder, distract, counter force, spring. Over here. Right. Distract, counter force, spring. So a lot of the elements are the same, and we've been doing these same concepts over and over. We've been distracting the joint apart, we've been taking out the joint slack, spring. Sometimes we take out the skin slack, like for internal external rotation. Questions on these? Give them a try? Here we go. Dr.